My stomach muscle separated with pregnancy. When you do a tuck, do you also deal with those? And if so, how? Yeah.
Where have you been?
Where have you been?
We said that to every question.
During a tummy tuck, there are a few set pieces. So in its simplest form, I guess, a full abdominoplasty is skin removal. Well, an abdominoplasty is skin removal, skin tightening. But I think it's fair to say we never ever just do that. Really never. For a full abdominoplasty rather than a mini, we're going to be doing something with the belly button as well, because we would pull the belly button far too far down otherwise. So that is called transposition of the belly button, or transposition of the umbilicus if you want to sound posh. There's usually muscle separation, and I think, you know, most people who walk through the door requesting a tummy tuck, when I measure their muscle separation, have at least 3 centimeters of muscle separation. That's kind of, that's just straight off the bat. Some of them, I came across someone last week who had 6 or 7 centimeters of muscle separation, which is quite impressive, actually. And I'm quite excited when I see that, because that's going to really sculpt their waist. They're used to having a more squarified, that is a word, squarified waist, because their muscle separation has let everything bulge out. So when you bring that back in, if you imagine maximally at the belly button, you'll just slurp them in around the sides. That's also a word. So that's always quite good. I've done 11 centimeters in the not too distant past of muscle separation. I get slightly anxious at that point that I'm going to make it hard for you to breathe a little bit, so we keep a close eye on you, chest physio, to make sure all is well. So yeah, yes, stomach muscles are absolutely dealt with. Other common things that get dealt with are Mons reduction. The Mons is the bikini area. We do a Mons lift. Liposuction. I mean, it'd be rare for you to get through one of my abdominoplasties without liposuction. At the same time as liposuction, you'd have contouring of the champagne groove, or as I'm increasingly hoping it gets called, the fub line. You'd get contouring of the semilunar lines, which are the areas on either side of the tummy. There would be quilting that takes place as well. Quilting is where we stitch down, close the dead space, but I also use quilting to contour. So there's all sorts of stuff, and these are all just a set piece, and it still just gets called a full abdominoplasty. I think people structure their practice in different ways. I've seen people sort of itemize bits of operations and add a bit for this and add a bit for that. This for me is just a full abdominoplasty or full lipo-abdominoplasty. And that's, if you need a Mons lift, you get a Mons lift. If you don't, you don't. It's the same. If you need contouring, then you're getting it. If you need less, then you don't. So that's very versatile, but there you go. So yeah.